For more than a century, local governments have played a key role in the health and well-being of their citizens. Today, that role is shifting, as is the health landscape. One thing hasn't changed, though. The health of the community overall has always had a big influence on the health of the people who live there. And local governments today have a big influence on the health of their communities. Consider this. At the turn of the 20th century, the top health concerns in BC were infectious diseases. Local governments got busy creating infrastructure so communities could have clean drinking water, sewage, and garbage disposal. When new industries emerged, all levels of government responded, with regulations to keep our air and water clean. By about 1950, we were a health success story. 95% of infectious diseases had been eliminated. The economy was growing, and BC was on the road to becoming the healthiest province in Canada. But today, we're facing a new reality. Changes to the way we live, work, and play have brought new health challenges. Chronic illness is now a leading cause of death. Obesity is a key contributor. So how does local government fit into the picture today? If anything, their role is even more critical. We know that our postal code has as much influence on our health as our genetic code. Local governments have the best understanding of their community's needs, and they have the ability to plan for and make decisions about the kind of community they want to build for future generations. As key decision makers, there are lots of ways local governments can build healthier communities. For example, by planning neighborhoods with sidewalks safe for walking and grocery stores, gardens, and farmers markets with fresh and affordable vegetables. And by designing ways to get around with our feet rather than our cars. They can create inclusive and welcoming public places to play, gather, and connect. And they can engage citizens, other levels of government, health authorities, and community partners so that everyone is involved. Local governments can and do have a major influence on the health and well-being of all citizens. And to make a positive difference, they don't need to start from scratch. By connecting the dots and bringing a health filter to what they're already doing, local governments can create communities where people don't just survive, they thrive, now and for generations to come.